Well, Thursday mornings on the Fox broadcast mean one thing. It's medical interview time. We're joined now by Dr. Albert Marr. He's an orthopedic surgeon at New Hanover Regional Medical Center, and he's here today to talk about the ankles. And I just mentioned to him off camera, he's the first to bring a prop. The precedent has been set. Doctors, step up your game. So we're going to talk specifically about ankle arthritis off the bat and how that affects patients. Is it a growing problem around the area?
It is. It's probably not as prevalent as total or hip and knee arthritis, sure. But you know, we're seeing it more now, and maybe because we have better treatment options for it.
What are some of the treatment options that we can do for that?
There are really two paths for treatment. The first path is conservative, weight loss, anti-inflammatories, activity modifications, bracing, cortisone shots. The other option would be surgical. Historically, the really only option we had was an ankle fusion. That's where the ankle is locked into place so it won't move anymore. Now, this is great for alleviating pain, but it sacrifices motion and therefore potentially activity.
Is there an age range that you're seeing people that are going to have to go the route of a surgical procedure where it is that serious?
Well, there's sort of two ways arthritis happens. One is post-traumatic, and that can be in the young, and the other is just wear and tear. So you see sort of two bumps, and some in the younger and then older than 55.
At what point do you, as a patient, think, well, I really got a problem here? Who are the candidates for something like this?
Well, right. So those two patient populations are usually the candidates. Once again, once they've failed conservative treatment, the fusion's an option. And then, of course, the other exciting thing is the total ankle replacement, which we've really just started doing in the past decade with the advancement of certain technologies. What an ankle replacement is where the arthritis is replaced by metal and plastic components. And this is great for alleviating the pain, but preserves motion and therefore allows more function.
And if you have to go that route, what type of recovery process are we talking? Is it extended? Is it brief?
Well, it is an inpatient type procedure. So the procedure takes about an hour and a half. The patient spends probably a night or two in the hospital. We don't let them walk on it for about 6 weeks. We do get it moving at about 2 weeks. But by 3 months, most patients are walking pain-free, back in regular shoes, starting to get back into daily activities.
Okay, and I always preface or end everything by saying if you feel you're a candidate, if you feel you have any problems, don't email me. Please go see your doctor. Doctor, I appreciate the time.
Thank you.
And the prop, I appreciate it.
Yes, sir.
Okay, moving on now. Charges in a controversy.